we're going to open enrollment. Some of the benefit changes for 2021. The most important change is the transition from Cigna to Empire Blue Cross Blue Shield for all of your health-related programs, so medical, pharmacy, dental, and vision. Through the 2021 benefit offerings, talk about employee cost share, go through the very detailed Empire tools and services that are available to you, talk to you about how to use your benefits most effectively and what you need to do to participate for 2021. So here we go. Let's begin. Held from January 8th to January 14th. This is a time during the year that you can change your plan elections. You can move from the core EPO plan to the buy-up EPO plan, or you could enroll for the first time, add or delete dependents to the various coverages that you have. Open enrollments are binding under your Section 125 plan, so unless you experience qualified life events during the year, this will be the program that you are in. I'm going to say this 3, 4, 5 times during this presentation. All current participants in New Jersey EPO, the New York EPO, or the PPO plan will automatically be enrolled in the core EPO plan. In order to participate in the buy-up EPO plan, you need to complete and return an enrollment form back to Maria in HR by January 14th, 2021. Because our negotiations with Cigna began early, we had a very difficult renewal. We had to go out to market, and so a decision was finally made the week before Christmas with contributions completed last week. So we really want to make sure that we get enrollment information into Empire so that employees will have ID cards in advance of February 1st. Empire Blue Cross Blue Shield will be the new medical, dental, and vision carrier. There'll be 2 EPO plan offerings, a core EPO plan that everyone will be defaulting to, and the buy-up EPO plan. Empire is also going to be the dental and vision carrier. There will be changes to, minor changes to the dental and the vision programs, and there will be changes to all of the medical and vision contributions. The contributions will remain the same as they are this year. Disability will continue to be administered by Unum. So this is in the 2-page handout that was submitted to the CFS staff last week, as well as the benefit guide. What I would like to do is to walk through what we have on the screen so that people understand the plan components. So extreme left column over here, this is the plan features. Here's what we have in the buy-up EPO plan, and here's what we have in the core EPO plan, what the plan features are. You will notice that, again, I want everybody to remember, everyone's going to be defaulted in this plan. If you want to move to this plan, you have to complete the enrollment form. So you see the network is Blue Access. Plan types are an EPO, an exclusive provider organization, which means that you have the freedom to see any physician you'd like in network. There are no out-of-network benefits. This was something that we considered carefully because of the high in-network utilization and the significant provider match that Empire gave to us compared to the Cigna providers that people used in 2020. So the lifetime maximums anymore. The annual deductible, you'll see there's a $6 amount and a family dollar amount. So the annual deductible in the buy-up plan is $1,000, $2,000, $1,500 for a single, $3,000 for a family. No insurance in the buy-up plan, 10% co-insurance in core EPO plan. Your annual out-of-pocket maximum in the buy-up plan is $400 for a single, $1,000 for a family, $1,600 for an individual, $13,200 for a family in the core EPO plan. Annual out-of-pocket maximum means is all of the deductibles, co-insurance, hopes, hospitalizations, emergency room copays, any of your pharmacy benefits, all of those services go to your maximum out-of-pocket. If you have paid out-of-pocket $6,600, that would mean that you would not be responsible for any other cost for service, whatever the employee copay is or deductible co-insurance in that plan year. Office visit copay in the buy-up plan is $25.40, $30.50 in the plan. No charge for preventive health. These plans come with Live Health Online, which is telehealth, and we're going to talk a little bit more about that. It's something that we really encourage people to consider carefully, not only because of the copay that's associated with it, but because in the pandemic we realize this is a very effective healthcare and behavioral healthcare delivery system. You'll see urgent care visits are $50 in either plan. Emergency room visits are $500 copay in either plan as well. The significant increase from last year, and that decision was made based upon the number of steerable emergency room visits we saw with the Cigna plan. Many people were using an emergency room versus going to an urgent care for visits that were not truly emergent. And of course, the copays for the emergency room be waived if anyone's admitted into the hospital. Feel that in the buy-up plan, the inpatient or outpatient hospital is subject to deductible, then covered at 100%. And in the core, it's subject to the deductible, and then 10% of the cost of services, maximum out-of-pocket. There are no out-of-network benefits. You'll hear that we have a $100 deductible on all prescription drugs. However, this does not apply to generic medication. So this is something that's important for you to look through the pharmacy drug list to see your current medications are. And you should be also making sure that you have enough fill of maintenance medication for the 2/1 prior to the 2/1 effective date. If the deductible applies, once the deductible is satisfied, then going to pay $15, $50, or $70 copays for tier 1, 2, or 3 drugs. In the buy-up plan, $15, $50, and $80 in core plan. And you'll see that the 90-day supply, again, will provide you with a 90-day supply of medication for some savings associated with your copay responsibility. Employee cost share, you'll see that there is a single cost share regardless if you're a New York or a New Jersey employee. Your contributions are based upon the plan that you elect, as well as the tier participation that you are going to, you're going to cover yourself, your, or other family members, and it really is determined on how much money you make. You'll see there's been a real attempt on the part of management to make sure that those people making less than $40,000 have smaller employee contributions, and the people earn more, they have a greater employee contribution to participate in the plan. So the contributions for individuals range from $17.50 to $60 based upon contributions. And then you'll also see that to participate in a buy-up plan, it does not make a difference what your salary level is what your biweekly contributions will be. So I said Shannon and Melissa on the line from Empire. I'm going to see, Shannon, would you like to spend a little time, or Melissa, talking through the Sydney Health app?
Certainly. Thank you, Therese. Good morning, everyone. I'm Shannon Hartbosch from Empire Blue Cross and Shield. We're excited your health insurance carrier this year. To be reviewing some tips and tools to help guide you through this process, and then I'll turn it over to Melissa, our specialty team, to walk you through dental and vision. But as we're looking at this screen here, this is our new Sydney app. It's our mobile app. We call it a mobile app, but it's really so much more than that. Think of it as like a personal health assistant in the palm of your hand. So once you become a member, we want to download this app through, if you have an iPhone, an Android, you can go to the Apple Store and download Sydney Health and be able to look at your ID card. So if you haven't got your ID card in the mail yet, you can pull an electronic version. I use this when I go to the doctor. It's just easier to put hands. You can check the status of a claim. If you haven't received your explanation of benefits in mail, you can check to see where your claim is and see where you are with your deductible and your out-of-pocket costs. So it's a really user-friendly app, and it's something that, again, I think that once you become a member, you should you can find a doctor. You can search different urgent cares, for example, in the area. So that is our Sydney Health mobile app. This next is really important. So right now, before you get your ID card in the mail, you can go out to our empireblue.com. This is, you might be feeling a little anxious. You want to check to see if your doctor is in our network. So right now, to empireblue.com, you'll have a selection for Find Care. The doctor, you search as a guest. It's really the most efficient way. And then here on this screen, step 2, you'll select medical. You'll select the state. So, for example, if you're in New York, getting care, you'll select the Blue Access Network. So that is the network for both of the EPO plans that Patrice just reviewed. If you're outside of New York getting care, you'll want to select our national PPO. That's our broadest network. So that's really great, especially like you, your family, you're out of, maybe vacation in Florida, can still get access to care through our Blue Card, with our Blue Cross Blue Shield Association, and the claim will still process as an in-network claim. So in New York, Blue Access is the network. Outside of New York, it's our national PPO. You'll continue, and then you can narrow your search down. You can search by the zip code, the type of provider you're looking for, and then it'll return a list of results. So that is our empireblue.com, Find a Doctor. And this is also a feature that's available on the Sydney Care mobile app. Once you're a member, you can search for a doctor as well. And next, I want to discuss our Live Health Online. This is our health vendor that we use, that you can see a doctor virtually through either your mobile phone, a tablet, even a computer with a webcam. Whether you're at home, you're on the go, doctors are available around the clock 24/7. So, and the nice thing that we're rolling out is that it's actually cheap than going to your doctor's office. So it's half of primary care copayment. So for example, if your primary care is $30, online, you log in, it's only $15. I personally have used this several times. It's so convenient, and they can even prescribe medication for basic symptoms like you have the coming down with like a flu, a sore throat, doctor had an eye infection when they were headed into the city. They logged into Live Health Online, found a doctor, held the to their eye and consulted with them, and was even able to pick up a script. And I think the whole thing took less than 30 minutes. So that's something just to keep in mind for you, your family members. Live Health Online, and again, you can find that through the Apple Store and download that. Now, Patrice or Melissa to walk through the dental plan.
Melissa BC from Empire. I just mentioned I'm going to go through your dental and your vision benefits. On screen there, you're going to see that your plans, you have two options. One is a dental HMO option with DMO, and the other is a PPO option, PPO allowing you to go in or out of network. On the left-hand side of the screen, that is a DMO, and on the right-hand side, that is a PPO. The most important thing is just, as she mentioned, please just make sure that your dentists are in the Empire network. As over on the medical, you're going to go out to empireblue.com. Before February 1st, just make sure to search as a guest. If you select the DMO plan, when you're on the tool, just make sure to put in dental HMO, in parentheses, it'll say managed care. And if you're searching on the PPO plan, the name of the network is called Dental Complete. When you're searched, that will pull up the dentists in your area that are either on the DMO or on the PPO plan. On the DMO plan, you still have your 2 cleanings per year. On DMO, you know that everything has a fee associated with it. Your visit copay is $0, but if you need anything else, such as a thing or maybe a root canal, there is a fee that is associated with the DMO plan. Your preventative care covered at 100%. You have no deductible. You have no out-of-pocket maximum. There is no maximum on this plan. What is great on the DMO plan is that orthodontia is covered. The orthodontia on the DMO plan works much differently than on the PPO plan. On the DMO plan, is it straight copay? So you would pay for your orthodontia work on the DMO. It's a $2,000 copay. Just make note, though, that everyone on the DMO plan in your family will have to see the same primary care dentist. It's like a referral to a specialist, or for orthodontia, your PCP dentist will have to refer you to that specialist or orthodontist. Watching online, you'll be able to find any DMO dentist in your area. You will have to elect a PCP dentist. If you happen to like to change that, you have until the 15th of every month to call us at Empire, and we're able to change that for you, and then it'll be effective on the following first of the month. On the side of the screen is that PPO plan. The PPO to go in or out of network. You're going to see there are differences between in and out of network. You're going to see that your co-insurance amount is lower, your out-of-pocket maximum is higher. You're going to see, though, that you do get 2 cleanings per year, whether you're going in or out of network. There is no office visit copay. You do a deductible of $50 per person on your plan, whether going in or out of network. The most, though, for your family, if you had more than 3 people, would be $150 deductible. That deductible is waived anytime you're getting your preventative care done. Preventative care are those 2 cleanings and your oral exams per year. And what is nice is that at Empire, we don't hold you hostage to those cleanings. Those are 2 to use throughout the year. Basic services are covered at 90% in network, meaning us at Empire, we pay for 90% up to your annual maximum. You're responsible for that remaining 10%. Of your root canals and your invasive teeth scale are also covered at 90%. And then for any of your major services, such as crowns, dentures, or bridges, that is covered at 60%, meaning we pay 60%. You're responsible for that remaining percent up to your annual maximum. On the in-network services, that annual maximum is $2,000 per person on your plan per year. And there's also orthodontia coverage on the PPO plan. On the PPO, you're going to see that to the $1,500 lifetime benefit for each person. That's much different than on the DMO. On the DMO, it's just a strict copay. On the PPO, the most that Empire would pay out is $1,500. Section is your out-of-network. So you happen to see a dentist that is out-of-network on the PPO. You're going to see the biggest differences there that on the basic services, such as your teeth fillings, your root canal, else, it's only an 80% coinsurance amount. And then major services, it goes down to a 50% coinsurance amount. And then also to note that the benefit maximum changes from $2,000 to $1,500 if you happen to go out of network. And the next going to be your dental premiums. What is great is that there are no increases to your dental costs for 2021. And then is going to be your vision plan. Plan on the screen are your in-network benefits. You can't out of network on the vision plan. It is extremely difficult, though. We have the largest vision network in the country. Some of our most well-known ones are Lens Crafters. We have Pearl Vision, that's a network. I personally use Target Optical just because it's really close and convenient for me. We also have numerous independent optometrists as well as ophthalmologists. We also online in networks such as 1-800-CONTACTS, Contacts Direct, Ray.com, and Glasses.com. If in network, you're going to see that your annual exam is a $10 copay. Your lenses in network have a $25 copay once every year. Your contacts are going to be one or the other, so you can either get lenses each year or contacts each year. If you're using contacts that are non-disposables, it's a $130 allowance plus 50% off your remaining balance. If you're disposables like I do, there is no 15% discount, but you do have that $130 allowance. And then do you need medically necessary contacts? Those are cut out 100%. Once every 24 months, you're able to take advantage in network of the frame allowance. You're going to come there that for frames, it is a $130 allowance and then 20% off any remaining balance. So in network, we have some really great enhancements, such as 4% off a second pair of eyeglasses, 20% off accessories such as sunglasses. So new discounts in network for you guys to take advantage of. When you're online at empireblue.com for vision providers, the network is called Blue View Vision, which is a tongue twister, but if you put Blue View Vision into the search engine, that's going to pull up all the vision providers in your area that are in our network. And then at the bottom of the screen there, you're going to see your vision premiums for 2021. With that, back over to you.
Mute. Swapping into the phone was going to be a good thing. Elena, do we have any questions in the chat box? Not far. Perfect. Again, all employees are covered one-time salary to a maximum of $100,000 with a minimum of $25,000 of life benefit. Employees are also covered by long-term disability, 60% of your monthly salary to $5,000 a month after 6 months of continuous disability. Down here, we just want to remind people to ensure that your beneficiaries' information is up to date. Things happen. People get married, they get divorced. Please ensure that you provide updated beneficiary information if your circumstances changed. Make the most of your benefits. Always try to use in-network providers. I mentioned earlier we did a provider disruption that took all of the 2020 medical providers, labs, hospitals, specialists, and we got those physicians' names, we got their ID numbers, and we matched it from Cigna, we matched it to Empire. It was over a 98 to 99% match. So you have a very strong network. It was actually stronger than the Cigna provider disruption. So try to use in-network providers. It's really important those providers are working with Empire because it's the largest network in the United States. And so they've agreed to certain discounts to work with Empire, and it helps keep costs down for not only you, but for the plan as a whole. Try urgent care over the emergency room whenever you can. particularly with that $500 copay. Also, on the Sydney app or the app that you put on your phone, you can search right there for urgent care centers. You have a choice of LabCorp or Quest or a number of independently owned labs, so definitely double check on that. Please make sure to get your annual preventive exams. It was a crazy year for everyone, and for a lot of us, we were unable to get preventive care, so let's make time for it in 2021. Be prepared when you go see your doctors. You can bring the doctors, most doctors now will have the PDL. It'll come right up when they're ordering your medications on their electronic screens. So write your questions, keep a list of your medications, talk to them about you have a new $100 deductible for non-generic drugs, and make sure that you're maximizing the plan so that you don't have as many out-of-pocket expenses. And again, use that mail order for. So when we do this, right, we want people to make sure, one, peers participate. That's really important. Then what you're going to do is you're going to compare the plan features, copays, deductibles, insurance within the plan, side-by-side comparison, and compare that to your monthly contributions. Because it may seem like, it's a $5 versus $30 copay for the buy-up EPO plan compared to the core EPO plan. But if your monthly contributions are going to be 2, 3, 4, 5, 6 times, that's something you really need to consider. And again, the other thing is we want people to say the best idea about how you're going to utilize the plan is how you've used it last year and the year before, as well as considering what's happening in your life in 2021. Are you going to be having a baby? Are you going to have that foot surgery that you needed to have done? So think about those medical requirements that you're going to have and choose the plan that makes the most sense for you and your family. So again, all employees are going to be defaulted into the core EPO plan. If you want to participate in the buy-up EPO plan, you're going to enroll for the first time. You're going to make any types of changes. You're to complete and return the 2021 enrollment form to Maria by January 14th. Your beneficiary information with HR, and in February, review your first paycheck to confirm that your elections are reflected correctly. Open this up. I'm going to mute myself for a second to see if anyone has any specific questions, and we're happy to answer them.
This is Gail Burr.
Putting away this stuff, the little decorations and stuff.
A lot of my doctors work out of the offices or in hospitals. So when I see them, and they'll send me for labs and tests and at the hospital itself, which is all my memos are done there, everything else. Is there going to be? Is this going to be covered the same way anything else will be covered, or?
Just mute for a second, Elena. Back from Cigna. Most of the, we did a list of certain providers. We reached out to Cigna. Cigna was saying that those providers, while they're located in a hospital-based situation, that they actually have labs, et cetera, that they're using. So I will get more information for you and get back to you on that. I did ping our Cigna person on that. Shannon, would you be able to, I know typically most hospital-based procedures are subject to deductible and copay, but if you could provide any color, and Gail, I will get back to you on that.
To the deductible insurance if there's co-insurance on the plan. As far as the individual doctors within, I would double check on our EmpireBlue.com just to make sure both the hospital and the provider are showing par. But we can certainly, if you ever have any questions as well, we can contact our customer service that can check for you. Or if I can work together as well if there's information from Cigna that we want to check on the Empire side.
Yeah. Okay, Gail.
I'm going to unmute.
Any other questions?
All right.
So with Elena, Shannon, and Melissa, we thank you for your time today, and we hope to work with you and the HR team to make this as smooth of a transition as possible. And we look forward to seeing you in person in 2021. Thank you.
Thank you.
Thank you.